weeks.
Here in the tri-state, COVID hospitalizations are staying slim but steady for most area hospitals, but demand for the COVID vaccine is fizzling out. A manager at Deaconess Pharmacy says that hospitalizations are staying low, but they are noticing a new trend.
The concerning thing that we're seeing now is the COVID in our younger patients. Again, with the new variants that are out there, which we've seen about 75% of our outpatient tests come back as the UK variant.
Brian Spencer says since the UK variant is more contagious, they encourage young, healthy adults to get the COVID vaccine, but fewer people are making appointments. Spencer says just 1 month ago, Deaconess was administering 1,000 to 1,200 doses a day.
We have seen the demand go down a little bit. We're still doing about 400 to 500 a day. We have the capacity to do about 1,400 a day.
Across the river, workers at Owensboro Health are noticing a similar trend. Pharmacy Director Jason Collins says he's noticed some people in rural communities are still hesitant to get the vaccine.
They're very concerned about the natives that heard the news at the very beginning. So they haven't really changed their mind yet. They're still kind of shying away from it in those rural areas.
B.C. Childress, the hospital's director of outpatient services, says ever since April, vaccination appointments have dropped off, but their hospitalizations have remained steady, with fewer than 10 COVID patients in the hospital at any one time.
We're not going to get to our target of 0 cases until vaccines reach more people.
And to help get closer to herd immunity, Owensboro Health is holding walk-in clinics at both their Owensboro and Muhlenberg County campuses. The first one is Monday in Owensboro.
New data shows expectant mothers can get vaccinated for COVID-19. Pregnant women were excluded from the original Phase 2 and Phase 3 clinical trials for the vaccines, leaving doctors wondering if the vaccines were safe for them. The CDC has now published one of the largest studies on that topic. Researchers observed 35,000 women who got doses of either the Pfizer or Moderna while or just before their pregnancy. They found COVID vaccines did not change the rate of miscarriages or other complications. Dr. Andrea Moore says that she recommends being vaccinated while expecting, since being pregnant puts you at high risk.
So they're more likely to be hospitalized, they're more likely to need intensive care, to be intubated or ventilated, and even there are higher rates of death for about 10% of the pregnant patients that get a severe COVID infection.
Dr. Moore says the biggest risk they see is pregnant women having miscarriages and preterm labor or delivery after getting sick with COVID. This week, the American Society for Reproductive Medicine endorsed pregnant women to be vaccinated for this reason.
Kentucky takes the first official steps toward a pre-pandemic state fair this summer. The state fair